later, but if I wash my hands out in the hallway and then come in and start touching her, she doesn't know that I washed my hands. Plus, I could have touched 5 things on the way and then still be bringing her in a nice infection before I start touching her, okay? So you always wash hands once you get in the room, okay? Clear? Provide privacy. I may need to adjust height to the bed and her positioning and things like that. The patient can be sitting on the side of the bed to begin with. This is a nice semi-Fowler's. I'm fine with that as well. Generally in acute care settings, they are laying in the bed, so it makes it easier. So when you practice, you're going to go down this. General survey. Overall skin color is normal, pink. I don't notice any obvious. Now as I go through, I'm going to look through the client when I do the musculoskeletal stuff and see if I notice any rashes. But in general, looking at her face, I don't notice the pallor. I don't notice jaundice. I don't notice any skin conditions of the face or anything like that. Hair, it's clean. It's washed. It's combed. I don't notice any obvious areas of alopecia. What's alopecia?
Hair loss.
Hair loss. She doesn't have excessive hair. In that regard, hygiene and grooming, she's clean. Her clothes are clean. Her, she no obvious foul odors. I mean, she's not wearing makeup. I don't think you don't wear makeup.
I wear
a little bit.
Yeah,
I don't even think you need it. So she, a little bit of makeup, so that shows grooming, that they take care of themselves. That's all part of that general survey. Body build, nutritional status is fine. We're looking at older clients, especially in long-term care, that are 99, and they are all skin and bones because they don't absorb that protein. So that is to be noted. A lot of their problems are we're always trying to get them to eat more. Okay, general body build, though, extreme obesity, things like that you want to know. Behavior. So when I come in and I introduce myself, at that point it's a great time. We always check. They usually have some sort of armband on. Can you tell me your name?
Mallory Antica.
So that starts to check the orientation. She knows who she is. Where are you at today?
Coastal Hospital.
And what's the date today?
No, it's August. Wait, what is it? August 27th.
Yeah.
My birthday was Monday. That's the only reason why.
Right. I missed that. Yeah, I was going to say. And she's 25. No.
No.
Not anyway. And so we've done level conscious orientation. I noticed in her voice, I don't have to do a separate question. Her voice is normal. I'm not noticing that she's whispering. She's not talking real loud. Her speech is normal. It's not garbled, which could be somebody with a hearing problem or lack of dentures or teeth that come like a little bit. Oh, yeah. I've met those people. We've all met those people. Where you're doing this. Like I have to see somebody talking like that. I'm like, and then I'm still praying. I get what they say. So that's all normal. You're noting that with the voice. Mental status, by asking questions, she's appropriately answering. And as you chat during the exam, you're developing that rapport. You can also develop, at that point, be noting mental status throughout the exam. That they're answering, following directions, that sort of thing.
Whenever when we get to this point, do we have to say, I noticed that their behavior's fine because they answered a lot of questions?
Yeah, you can. Or sometime in it, yeah. Or nonverbal behavior is appropriate. She's not crying uncontrollably or laughing uncontrollably. She's paying attention. She's not curled up in the corner of the bed, avoiding me, that kind of stuff. So at some point you can note that position, posture, and activity. She's able to sit up in the bed. If I have her sit on the side, I'm going to not just so everybody can see, but you're welcome to have your clients stay seated on the side of the bed up until we do that cardiac assessment, okay? So we've gotten through the whole first section there. Chief complaint, what brought you in today?
I don't know. So let's just say for a physical.
For a physical, okay. If she said a symptom like abdominal pain, you've got the acronym there, PQRSTA, so you'll ask them when did the pain start, what started the pain, what provoked it, the quality of the pain, tell me about the pain. Is it burning, is it pressure, is it sharp, is it tingly? Region, does it radiate, does it stay in the same area, where is it your arm, your leg, a lot of times they say stomach pain, but you want to clarify stomach, okay? Some people know their stomach's up here. When you say stomach to me, I assume you know your stomach's right here, and you're talking about stomach. Some people mean stomach, and it's maybe a female issue, okay? So, again, have them point to the area under that region. Severity. Again, there's the scale of 0 to 5 at Onslow, but a lot of in your book is 0 to 10. 10 being the worst pain you've ever, and you need to explain them to the scale to them. Though once the patient's been there 24 hours, they're better at explaining that. How's your shawl, Beth? I've laughed all morning. Severity. The other thing to use for children, for example, is a FACES scale. It's in your book. It's called Wong's Faces Scale. They may not understand the 0 to 10 thing. So it's faces. There's a unhappy face. There's a, okay. How do you feel? I've used that with physicians who were not very nice. If you could let me know where you're at today, then we can all start on the right. And you know, he was always nice. I don't think he realized he came in grumpy every day. Yeah, I had a little arrow up. You'll just point to where you're at, so I'll know how to approach you. It's a great scale, though. It's the Wong's Faces Scale for severity. Timing, when does it come on? Does the stomach pain come on after you eat, before you eat? And then any associated stuff that they've noticed. Well, it's stomach pain. Oh, and by the way, I have diarrhea. Okay, so associated symptoms. That's your PQRSTA. You'll hear it and hear it and hear it and hear it. Okay, that we want you to be asking those symptoms. We're horrible. It's a big problem with hospitals that we're not doing the PQRS. We're not doing good pain. We do a good assessment. We try to treat it, then we never follow up. We never ask them again.
We're doing this on